This is Tara with NCFlex, and we'll get started in just a minute. All right, I'm gonna go ahead and get started. This is the NCFlex November employee session. We try to do these each month with a different topic. This month's topic it includes the cancer and the critical illness plan. So we have two plans we're talking about today. Each plan is its own plan. It's administered by a different vendor, but they both bring cancer into them, cancer diagnosis, and pay for things related to cancer, which is a lot of times why we talk about them together. They're also both considered what we call supplemental medical plans. They do not take place of a medical plan, but they can help pay out money to you for that helps with out-of-pocket medical expenses. So that's why we call it a supplemental medical. And the other one we have that's what we consider a supplemental medical is our accident plan. And that one we're actually going to talk about next month in December if you're interested in joining that. So today we're going to talk about with both these plans, who's eligible, when you can enroll in them or make changes, an overview of each of the plans, what pre-existing conditions means for each of them, 1099s, when you'll be sent one of those due to a payment from the plan, how to file a claim, continuation options if you leave employment, and then some contact information towards the end. I'm recording today's session, so afterwards I'm going to send you a copy of the recording, a copy of these slides, and then I also there is a piece of the critical illness plan that we're going to talk about for the infectious disease benefit rider, and I'm going to send you some information on how to file that. And if you don't know what that is, we're going to talk about it. So who's eligible for the plans? For most of the NCFlex plans, we have our state agencies, our universities, participating community colleges, and participating charter schools. If you work 20 hours or more per week in a permanent, probationary, or time-limited position. NCFlex benefits are offered to all of these locations. When it says participating community college or participating charter school, we have certain ones that have signed up to use our benefits. If you don't see one of the plans you think you have on your enrollment platform, you may have an agency-specific plan or an employer-specific plan because some employers do have their own benefits that you can buy into if you work there. So you could check with your HR department if you're not sure of what you have and if it's through NCFlex or not. The dependents that you're allowed to cover on these plans include your legally married spouse and your children. That's including natural, stepchildren, or adopted children up to age 26. Your children can continue on the plan if they are unable to make a living because of a mental or physical handicap, as long as that handicap developed before they turned 26 and they were covered on that plan. You want to continue them on before they were 26, and then you want to continue past that date. And you can reach out to us with questions about that. Some additional information about who is eligible. You must be enrolled in a plan for your dependents to participate. So you're not allowed to only cover a child or a spouse. You also have to be covered. But with that being said, you do not have to have that last bullet. Dependents do not have to be enrolled in your health plan to be enrolled in your NCFlex plans. And you can pick and choose which ones they are covered by. You may want a child covered by the critical illness, but not the cancer plan. Our critical illness plan covers children at no cost, so maybe it's that you want to add them on that, but not another one. And that's fine. This is a cafeteria plan, so you can kind of pick and choose which ones you want. Just as long as you're covered, you can cover your eligible dependents. That second bullet notes that you may not be covered as both an employee and a dependent, and children may not be duly enrolled. So at no point should you or a family member be duly enrolled in the NCFlex plans. It's different when you have, maybe you have the NCFlex cancer plan and you might have a cancer plan somewhere else with a different vendor, then those are independent of each other. But as far as having double coverage under the NCFlex cancer plan or critical illness plan, they're not going to pay you twice. So if you do have a family member that works for the state, just make sure you're not double covering anyone. And if you find out you are, reach out to your HR department and let them know that you'd like to get that corrected. The third bullet notes that you should consult with a tax advisor if you have questions as to whether someone qualifies as your income tax dependent. And then the next slide talks about when you can enroll. So when are the periods that you can choose one of these plans or make changes to one of these plans? When you are newly hired or newly eligible. So newly eligible would be if you were a temporary employee and moved to a permanent role, or you were working under 20 hours and then went over 20 hours, you're newly eligible, or you're a new hire. You have 30 days from that date to enroll in the benefits. After that, you have an annual enrollment each year, which is typically in October. We just finished ours October 25th for the 2025 plan year. And when you make a change or enroll during that time, it's effective January 1st of the following year. Qualifying life events, that's the third way you can enroll or make a change, is if you have an event like marriage, birth, loss of other coverage, gain of other coverage, divorce, separation. These are times where you can make certain changes to your benefits. A note at the bottom that for university employees, you will need to use the UNC Empyrean platform to enroll in or make changes to the NCFlex benefits. You, as a university employee, will have two platforms. You have eBenefits for your medical and Empyrean for your NCFlex. All right, so jumping right into the cancer and specified disease benefit. This benefit is through Allstate. It's called cancer and specified disease because it does pay out benefits when you are diagnosed with cancer or one of their other 29 specified diseases, which I will show you on another slide. You have the choice between low, high, and premium option. And of course, the difference is going to be how much you pay per month. The monthly costs are over there to the right, and also how much they're going to pay out to you for certain instances. So you choose the option, and I'm going to talk a little bit more about pre-existing conditions on another slide, but for now, I'll note that this coverage, the cancer plan, does not have an EOI or evidence of insurability required. So you don't have to answer medical questions to be on this plan. But again, I'll talk more about pre-existing conditions in just a little bit. There is a cancer prevention and screening benefit included on this, which we call a wellness benefit. That's something that's payable even if you're not diagnosed with cancer or one of their other diseases. That benefit is still payable for doing a routine screening, which I'm going to talk more about. And if you have the low option, it's $25 per covered person per year that you could get. The high and premium both have a $100 benefit for that per person per year. Benefits are going to be paid directly to you as an employee unless you are not living, and then it would pay to a beneficiary that you have listed or to your estate if you don't have a beneficiary listed. You can list a beneficiary in the enrollment platform, and that can be changed at any time during the plan year. And I can show you a screen of where you can go to update those beneficiaries towards the end if you would like to see that. And you can also check them there just to make sure you have the right ones. There is a waiver of premium available if you become disabled due to cancer. It's available after 90 days of being out, and it goes for as long as your disability lasts. And that's for just the employee premium, not the family premium. So your premium would be covered if you're approved by that. So if you did go out due to disability, we have a few plans that have that waiver of premium option due to disability. So if you go out on disability, just check with your HR department on what those might be and how you can apply. And then this coverage can be continued after you leave the state, and we'll talk more about that on another slide. So this is a list of the 29 specified diseases outside of cancer that are included in this benefit. And I won't stay on here too long, but it just shows you that it's more than just cancer diagnosis. It includes Lyme disease, cystic fibrosis, Addison's disease, muscular dystrophy, and several other things. And we'll also talk more about continuing these plans when you leave towards the end. So this slide gives you an example of some of the benefits that are payable on the cancer and specified disease. So both plans, cancer and critical illness, again, have a benefit for cancer. With this plan, it's going to pay out once you're diagnosed and you have certain events happen, which are, again, examples on the screen, and it'll pay out certain amounts. The critical illness plan pays just on the diagnosis. So you get a lump sum just for being diagnosed. So they're two different types of benefits, and they are both payable on top of each other. So you can have both plans if you want to. There's things on here like inpatient drugs and medicine, radiation and chemotherapy, private duty nursing services, and then at the top, that's where that cancer prevention and screening benefit is. That's payable once per year per covered person. And if you look at, like, if you have the high option, because this is the one I have for my family, and when you end up looking at how much you pay per year, and then how much you can get back from that cancer prevention and screening benefit, you could sometimes pay for the whole thing, depending on how many people are on your plan. And also remember that our premiums come out pre-tax from your check. So when they come out pre-tax, you're saving, you're not actually paying the amount, the monthly amount that's on there. Like this $23.90 a month is going to be more like $18 that comes out of your check, maybe 19. It's going to be like 75% of that on average when you're saving taxes. So this slide shows you the eligible screenings for our wellness benefit. This is the benefit that would pay out to you regardless of if you're diagnosed with anything. This is just for doing a routine screening. There are more common things on here like colonoscopy, pap smear mammogram, lipid panel, which is going to be where you get your cholesterol checked each year if you go to the doctor for your routine physical. And then you've got some other things on here like echocardiogram, biopsy for skin cancer, bone marrow testing. And this benefit, which I think I have it on here, you can file it once per year per covered person. Even if you have multiple screenings, you're just going to file it once per year. You can file for prior years on the Allstate plan. So if you've never filed this benefit, you can go back and file for as many years as you've had the plan. Let's see. I'm trying to find a link to the wellness benefit. So I'm going to put a link to the flyer in the chat here. So you can see if you'd like to save that, it shows you all the screenings and how to file. If you have been on the plan and were diagnosed with breast cancer, this is a question that came in, and how to pay out, will your yearly routine mammogram still be considered a wellness screening, or is it preventative at that point? That's a good question. So these screenings, you file them with your medical insurance. Even if they're covered by medical, that is separate from this plan. This plan is still going to pay you out a benefit regardless of what medical pays. So even if that screening is preventative and covered at full cost, you're still going to get that check from Allstate. So this is outside of your medical plan. Okay, this is just you getting a benefit for doing a routine screening. You can file online or via paper form. And this, what I put in the chat was the flyer, and then the next I'm going to give you the wellness paper form if you prefer to file it via paper. So check out, if you do go to Allstate's website, which is on that flyer, you can log in and look at your account and see which years you filed for. And if you have other people on your plan, children, spouse, see if you filed for them. And if you haven't for all the years you've had the plan, you can go back and file for prior years if you had one of those screenings done. And payment can be made by direct deposit to your bank account or via check. You choose. If you choose bank account, once they approve it, I mean, you'll get that direct deposit usually within 2 to 3 business days. It's pretty quick for this payout. Let's see. One thing I want to show you really quickly is I'm gonna go to the e-benefits portal real quick, and I want to show you, and I'll share my screen in just a minute of what I'm looking at. I'm just gonna log in. So as you said, if you have only filed for just this year, how can you go back and file the previous years? So you log into your Allstate account and file that way, or you file via paper form. And just because Allstate does require documentation, so when you send in that documentation, they're going to see what year it was on, and I think it might ask you what year it's for, like the date of service. See. So I'm going to share my my e-benefits portal. Whether you're university or non-university, you have e-benefits. University, your medical is in here, but you still have these quick links. And university employees, you also have these quick links in your Empyrean platform. It's just going to look a little different. But if you go to the e-benefits portal, this is as soon as you log in. And you can, for those of you with Fiori, you can log in directly from Fiori. Otherwise, you should have either a direct link on your HR portal, or you can go to our website and click Enroll Now, and that will direct you to where you need to go. But once you get in here, you can see under Quick Links, there's a link to Allstate. If you have an account with Allstate, this is going to automatically log you in, or if you have benefit with Allstate. So when you log in, you can see if you have filed prior wellness claims, you can see the status, and this is where you can actually start a claim. So you can either file a cancer claim on here or a wellness claim. And then it's going to ask you, see the date of service. That's going to indicate to them what the date of what the year was, what the date was. And then you'll need to upload a document. And that document can just be a summary of benefits, or sorry, a summary of service from your doctor's office. It needs to have the date of service and what procedure was done. Okay, so Becky said that she filed for the first time this year her Blue Cross Blue Shield EOB forms that she downloaded from Blue Cross Blue Shield work for providing verification. That's awesome. And you didn't know you could file previous years. Is this also where you would go to file a Lymes claim? Yes. So Allstate is going to be where you would file that also. When I was on this page where I clicked file a claim, instead of clicking, oh, it's going to go straight to the wellness now. But there was an option to, oh, here it is, under the cancer plan, you could click file a claim, and that's where you would, and it says, what are the diagnosis or conditions for this claim? And that's where you would put the information, and you would fill this out. And you can click the supporting documentation to see what documentation it's going to ask for different benefits. So this is not going to pay again for a diagnosis. It's going to actually pay for these different things that you have done because of that diagnosis. But yes, that's where you can file that claim. All right, I'm going to go back to, whoops, do that. Let me go back to my PowerPoint slide for you. Okay, So that was on the cancer wellness benefit. And also similar to filing just a cancer claim for one of the other diagnoses. This is a cancer claim example of how someone was paid out. This person undergoes her annual cancer screening and was diagnosed with cancer. It notes over here to the left that in 2019, the national patient economic burden associated with cancer was $21.09 billion. 16.22 billion was patient out-of-pocket cost. And then 4.87 billion was inpatient, was patient time cost. So in the middle, it shows that this person undergoes surgery, anesthesia, radiation, chemotherapy, and is visited by a doctor during the 3-day hospital stay. And it shows what her payouts were, and she ended up getting about $7,200 from the cancer plan. So for the person who said, where do you create the Allstate account? If you have the cancer plan, that account is automatically created as far as going through e-benefits and clicking on that quick link. But if you just want to go to their website and log in, if you've never created an account before, their website is mybenefits.allstate.com. But again, if you go through e-benefits, the quick link, it'll just automatically log you in. So Becky said, can you file claims for previous years if you were enrolled then? Not the annual wellness. Oh, it just went away. Sorry. Not the annual wellness benefit, but an actual claim for a previous year. Yes, so the Allstate's claim process, they do allow claims for prior years. Voya is different and more strict on that. So we're going to talk about Voya's claim process. Allstate, though, they are going to require documentation, but they're going to let you go back as far as you've had the plan. This slide just talks about the American Cancer Society, and they have a Get Well program that helps support cancer patients and their caregivers. They have a dedicated toll-free number to provide access to transportation, lodging, medical insurance review, oncology, nurse second opinions. And this information, I believe, is provided to you if you file a cancer claim with Allstate, but you can also find it online. So now going into the critical illness plan, this one is administered by Voya. Before January of 2023, it was administered by Allstate, and then the plan switched to Voya in 2023. This one, like I mentioned earlier, provides a lump sum benefit of $15,000, $25,000, $40,000, or a percentage of that elected amount, depending on the diagnosis. So when you enroll in the plan, you enroll in one of those amounts, the $15,000, $25,000, or $40,000. And then that would be what would be payable if you were diagnosed, or a percentage of that depending on the diagnosis. And I'll show you the list of what you could be diagnosed with to get a payout. This plan does not require medical questions at enrollment either, but diagnoses are only payable that happen on or after your effective date. The benefit is paid directly to you. Unless you are not living, then it's going to be paid to your beneficiary or your estate. This one has a wellness benefit and an infectious disease benefit rider, which I'll talk more about. The wellness benefit is similar to the Allstate wellness benefit, but they do have some different screenings on the list, and it's filed differently. And they do not require documentation, but they have a time limit. For some illnesses, benefits are payable for an unlimited amount of reoccurrences with a 6-month period in between. So for instance, if someone had a heart attack and then 8 months later they had another heart attack, both would be payable because there's a six-month period in between. So these are the diagnoses that are payable. The ones on the top are payable at 100%, and the ones on the bottom are payable at certain percentages. We have certificates on our website that go into more detail on each of these. So some things like the infectious disease, for instance, it's going to talk about in the certificate that that benefit is payable when you're diagnosed with an infectious disease and you're hospitalized for 5 or more days. And it gives examples of what those infectious diseases could be. Someone said, so in terms of cancer, the cancer plan pays for diagnosis and care. Seems like from the example on one of your last slides, and critical illness pays for diagnosis. So the cancer plan does not pay for a diagnosis. They only pay for care, and different types of care pay out different amounts. The critical illness plan only pays for diagnosis. Let's see. So this has some other things on it that you'll see that are kind of common, like advanced dementia, including Alzheimer's, cancer, stroke, heart attack, severe burns, benign brain tumor, Huntington's disease, type 1 diabetes. But again, the diagnosis has to happen on or after the date your plan becomes effective. So the wellness benefit on the critical illness plan, this one pays $50 for you or your covered spouse and $25 for covered children. Again, this one's payable once per year per covered person for completing an eligible health screening. These are the eligible health screenings that are on the slide. I'm going to try to find the flyer for this real quick. Because this one is filed on voya.com/claims website. And so I'm going to put this in the chat. Critical, and this is also this benefit is also on the accident plan. So if you have both plans, you can file it on both plans at the same time. Critical illness does not cover surgeries. Someone just asked that were necessary due to complications from cancer surgery. It's only paying out for a diagnosis. And then someone said, can you show prior screen with diagnosis? Yes. And again, I'll send out these slides and you can find these on our website, and you'll also have this recording. But the wellness benefit flyer is in the chat now if you want to click on that to see that. A little bit more about this wellness benefit is that Voya does not require documentation. I think I have this on another slide, but I'll go ahead and mention this. They do not require documentation, but they give you a limit of 6 months or the end of the plan year. So you do have a time limit on this. And yes, you can be paid for the same wellness screening for both plans. And if you have cancer, critical illness, and accident, you can get paid for all three. But this one has some screenings that cancer does not. For the person who asked about the follow-up surgeries, you said you meant the cancer plan. I think it just depends on what kind of surgery that is, because the cancer plan, let's see, you would have to look at the certificate and Allstate would make that decision on what's payable and what's not. And I'm not really familiar with what surgeries are payable. I think they're in the certificate. There's also probably some information on what surgeries are payable. And I'm trying to find the certificate or put to post that, but I can't find it. Let's see. There's a summary of benefits here. So there is surgery on here per surgery based on surgical schedule, but then you want to look into the certificate to see what the actual definition of surgery was. And I'm gonna post the cancer plan low option certificate on here in the chat that you can pull up and you can search for surgery and that may give you more information. But you can always file it just in case. So Julie said my daughter was diagnosed with lupus and hospitalized in 2022 and was covered under the critical illness plan. In 2022, Allstate did not have the SLE listed on their plan. In 2023, Voya did. If the diagnosis happened in 2022, Voya will not pay for it. If the diagnosis happened 2023 or after, it would be payable under Voya if you had the plan. But Voya is not going to pay for anything that happened prior to 2023 because the diagnosis has to have happened on or after the effective date. However, Voya has different definitions for different things. For instance, major organ transplant, Voya's definition and Allstate's definition were much different. One was you had to have both, like if it was a kidney, you had to have both kidneys fail. And if it was other organs, it was like you had to be on the transplant list, whereas one said that you had to actually have had the transplant. So depends on the definition and it depends on what date it happened, if it was payable or not, basically. You could always call Voya and ask, but I'm assuming if it happened in 2022, Voya is not going to pay that. Okay. So moving on to more information on critical illness. So there is also what we call an infectious disease or infectious condition benefit rider, also called an infectious disease benefit rider. So the critical illness plan has a benefit for an infectious disease. If you're diagnosed, there's different diseases on that list, and if you are hospitalized for 5 or more days. But the rider itself is only for COVID, and it's if you are diagnosed with COVID, you get a $100 benefit payable once per calendar year per covered person. And I'm going to show you really quickly the screenshots because we've had people ask how you file that, and I went through this myself earlier in the plan year. And I'm going to show you those screenshots, but I'm also going to send it to you in case you think, well, I was diagnosed with COVID this year, because you only have until the end of the plan year to file or 6 months after, whichever's later. The diagnosis must have been confirmed by a medical professional. So again, there's a $100 benefit for that. And then if you happen to go into the hospital for 20 hours or more, then you would be also paid $2,000. And then if the hospitalization went 5 or more days, that's when the actual infectious disease benefit would kick in, and you'd be paid 25% of your critical illness benefit. So I'll pull this up real quick and show you some screenshots that I took from this infectious disease benefit. Hopefully you can see the screen. Okay. So this just notes that you first go to voya.com/claims. That's where you're going to go anytime you start a Voya accident claim or critical illness claim, a wellness claim through Voya, or this infectious disease benefit rider. Yes, if you were diagnosed with COVID this year in 2024, I would file it by December 31st. But you do technically have 6 months from the date of diagnosis. So if it just happened like this month or last month, you technically have 6 months. But if it was earlier in the plan year, file it by December 31st. But you go to voya.com/claims, you're going to click start a claim under get started or get started under start a claim. And this is just going to walk you through it. On the next screen, you'll see before you begin, it's going to give you some information about what you're going to need before you begin. And one of those things for the infectious disease rider is going to be documentation. If you're filing a wellness claim here, you do not need documentation, but you do need the date of service for that wellness benefit. So these beginning screens are actually going to be for any of these Voya claims that you'd file. So on the next screen, and this might not be big enough for you, but on the next screen, you're going to be asked which best describes you. Are you the policyholder? Most of the time, that's going to be you as the employee. But if you are someone else, if you were filing on behalf of someone, then you would pick a different one. But in this scenario, I'm choosing policyholder. On the next screen, it's going to ask who you're filing the claim for. Is it for yourself, your spouse, or your child? Domestic partner does not count on our plans. That would be for other states may consider those under their plans, but our certificate does not allow domestic partners. So you would choose who you're filing the plan for. You can choose multiple if you need to, because maybe both you and a family member were diagnosed with COVID or filing a wellness benefit for them. So you can choose them at the same time. And once you click continue, it's going to ask you information about yourself. If you add a family member on there, it's going to show, take a picture. When you're saying the payout, what do you mean? Payout for what? And then I'll go to it. But here you'd fill out for COVID. Yes, I'll go back to that in just a minute. So here you'd fill out your information. If you included a spouse or a child, you would also fill out their information. It'll put that at the bottom. Once you do that, on the next screen, it's going to ask you to fill out your address and your phone number, your email address. And sometimes it'll populate this. If you've filed a claim before, it'll populate some of that for you. On the next screen, it asks you for your employer and your group number, which I've put here. If you filed a claim before with Voya, it will probably populate that for you, because as I was doing this, it populated it for me. And that's when you get to this screen where you're going to choose what type of claim you're filing. If it's a wellness screening for accident or critical illness, that's what you're going to choose. If it's an accident claim, you choose accident. And if it's a critical illness or the what we're calling today the infectious disease benefit rider, you're going to choose serious illness. And I note that here in the instructions, but you're going to choose serious illness. Oops. And then you're going to go down, choose critical illness because that's the plan it's under. It's going to ask you which state it was issued in. You'll choose North Carolina. So again, this just takes you through all the steps. And then it goes to the list of critical illnesses. You choose infectious disease because even though it was just a diagnosis, and maybe even if you weren't hospitalized, it will still be under that. And then you'll be prompted to upload supporting documentation if you're ready, or you can do it later. But the faster you upload the supporting documentation for that COVID-19 diagnosis, the faster they're going to pay you. So if you wait and upload it, you might forget. So if you can't upload that, it could just be a summary from your doctor that says we have a diagnosis from this on a doctor's portal or something. Does a screening have to be filed on a separate claim? For example, mammogram, colonoscopy, or can they be filed on the same claim? So you can only do one screening per year per covered person. So for Voya, you're only going to file one time this year. So if you do have multiple screenings, you're only filing one of those. But these screens that you're seeing are for that infectious disease benefit rider. And then on the next couple screens, it's just going to ask you what payment you prefer. And ask you to save your progress. So what proof you need for COVID, you just need, here it says attending physician statement for critical illness specified disease form. Really just a summary from your doctor's visit or your hospital visit or your urgent care visit, wherever they diagnosed you with it, some kind of summary showing the diagnosis, your name, and the date. Okay. It could be a written statement from the doctor. Just, it says here, proof of treatment, evidence like itemized bill, medical emergency records. But if it's for the COVID diagnosis, they're going to want to see somewhere that you were diagnosed with COVID. Some kind of something from the doctor's office, urgent care, summary of benefits. So if I have completed 3 health screenings, I can only file for one on the Voya website per year. That's correct. But if you have the accident and critical illness plan, you can file them both at the same time. Okay, but yes, it's just once per year per covered person. All right, I'm going to go back to my slideshow and I'll send those instructions out to you guys. So I think someone wanted me to go back to this screen and you wanted to take a snapshot of it, of the infectious benefit rider, infectious disease benefit rider. Oh. So these are the critical illness rates. They're on our website. They're in our guide. But it shows you that the rates are based on age and also which lump sum amount you choose. It's going to go up like if you, whatever your age is as of January 1st, that's what your premium's going to be per month. These are monthly costs. So if you're paid semi-monthly, divide these by half, and that's your cost per check for 24 times a year. I think if you're paid 26 times, 2 checks don't have the deductions. If you cover children on this plan under age 26, they are covered at no cost, but you do have to elect them in the enrollment system. Rates for you and your spouse are based on your age. So if your spouse is older than you, younger than you, it doesn't matter. It's based on your age. The rates listed on the chart are monthly rates per covered person. So if you cover you and your spouse, double that rate. So if you're age 40 and you choose a 25,000 amount and you cover you and your spouse, it's going to be $7 times 2, which is $14. And then your children can be covered at no cost. This plan does not require evidence of insurability, that's medical questions. However, any diagnosis must occur on or after the coverage effective date and meet the other certificate requirements to be payable. So let's talk a little bit about pre-existing conditions. With our critical illness plan, again, benefits are payable only for a diagnosis that occurs on or after the effective date of coverage. So pre-existing conditions don't even come into play because anything you were diagnosed with before is not payable. It has to happen on or after your effective date. For the cancer and specified disease plan, benefits are not payable for a pre-existing condition during the first 12 months that you have the plan. So and it notes on that third bullet that a pre-existing condition is a disease or physical condition for which medical advice or treatment was received by the covered person during the 12-month period prior to the effective date of coverage. And then if you had that situation in that first 12 months of your coverage, nothing's payable on that condition, but after that 12 months, it is payable. During that 12-month waiting period, you do still have the cancer wellness and screening benefit payable. 1099s, if for the cancer plan, you will not receive a 1099 for tax purposes, but for the critical illness plan, hold on 1 second, I'm sorry. Let's see. I need to go back. I'm sorry about that. 1099s, if you receive a benefit payment from the critical illness plan or the accident plan, even though we're not talking about that one today, that's a void product, you will receive a 1099 in January the following year for filing taxes. And that's only if you receive $600 or more from the plans, and that will be combined for accident and critical illness. That includes wellness benefit payments, but if what you received was under $600, you will not receive a 1099. If you have questions about filing this with your taxes, please contact a tax professional, because in some cases, if you had out-of-pocket medical bills, you may be able to offset a portion of the money you receive from the plans if you didn't use a healthcare FSA to pay for those out-of-pocket costs. You do not get a 1099 for the cancer plan. No, it's only for the critical illness and accident plans. So just prepare if you do get a payout that you may have to file that on your taxes, depending on if you paid any out-of-pocket medical bills. So filing claims, I've mentioned this kind of throughout the deadlines, but Allstate has no time limit to file claims, cancer or wellness. They have a paper form on our website, which I also, well, I linked the wellness one in our chat, but you can find the paper form for the cancer plan on our website. Or you can file online through allstatebenefits.com/mybenefits, or you can go to eBenefits under quick links and automatically log in. For the critical illness plan, you have 6 months after the screening to file a wellness claim, or by the end of the plan year, whichever is later. Diagnosis diagnoses prior to January 1st of 2023 should be filed with Allstate. Wellness benefits for critical illness and accident, again, you have 6 months after the screening to file the wellness claim, or by the end of the plan year. And that first bullet up there, I didn't mean to put screening, because it's not a wellness claim, but the critical illness diagnosis, you would have 6 months as well, or the end of the plan year. And then you can visit our critical illness section for flyers with more information on filing claims, of course. This just notes Voya's website is a one-stop shop. The claim center, you can file a claim, check the status, print a checklist, watch a how-to video. They walk you through the process of filing some claims. That's our group policy name, group policy number, and wellness claims are formless for the Voya plans. Critical illness claims do require, at a minimum, the critical illness claim form, which could be online, and the attending physician statement form or some kind of medical documentation. This is a checklist for critical illness claims, which you can pull up on that website too. Can you file claims having a Medicaid health plan? As far as I know, you can. I don't think that health plan makes a difference. If someone else on the team thinks differently, please chat that in. For continuation, both the cancer and critical illness plans can be continued once you leave the state due to retirement or another reason. For critical illness, to continue that, you do have to be under age 70. You will receive a portability letter from their customer service, and that's where you choose to continue the plan directly with the vendor. You continue at the same rate you pay as an employee, and payments are made directly to Allstate and Voya once you leave. The timeline for filing an accident claim, Julie, is the same as the critical illness claim. It's 6 months or the end of the plan year, whichever is later. Voya has the same rules for critical illness and accident. If you don't receive a letter after you leave, you can give the vendors a call and let them know you're interested in continuing your benefits. You can only continue a plan you have. So if you don't have the cancer or critical illness plan, you cannot continue them. These are some additional resources for you if you have questions afterwards. We have our website, lots of information on there. Our email address, there's Allstate's phone number and their website, and Voya's customer service through Life Help phone number and their email address. You can reach out to them. Any additional questions? So when you say divorce process, I'm assuming you mean if you're divorced, once you divorce, your spouse is not legally allowed to be on your plan, your ex-spouse. So that would be a qualifying life event where you could remove them or you could add a plan. And that's done through the enrollment system. If you're non-university, it's done through e-benefits. Same thing with legally separated. You do have to provide documentation with that date on it. You have 30 days to make a change in the enrollment system. And that's either going to be done through e-benefits or through Empyrean, whether you're university or non-university. Can I go back to the portability slide right there, I think? Does cancer diagnosis require a biopsy result? I do not know what that requires on the critical illness plan, but I will show you, let's see. The certificates online are great for when you're trying to answer, like you're trying to see what something might need if you were going to file a claim. I would start with the certificates. For instance, are domestic partners allowed on any of the employee benefit plans? They are not. We have a grandfathered in policy with UNC Chapel Hill on our dental plan, and that's the only one we have. And that was something that was agreed upon years ago. But other than that, no other plans are allowed to have domestic partners. So this is the critical illness insurance plan certificate. And when I have questions like what you just asked about that cancer diagnosis, I'll usually go in here and kind of search it. Okay, thank you for that information. Someone just said they had to use both when their husband got cancer and they were both wonderful. That's good. So you asked if I leave the plan before 70, will the critical insurance plan continue beyond 70? I think it stops at age 70. And I'm gonna look in here. So this says under portability, let's see if I can make it bigger. Portability means you have the option to continue coverage. You must elect portability before you reach age 70. You may continue your coverage if you would otherwise terminate. I do think it ends at age 70, but you could always double check with Life Help. But I think that it has to end at age 70. Let's see. Someone asked about the cancer diagnosis. No. If you're legally separated and spouse has a heart attack, triple bypass surgery, can you file? If you're legally separated and not divorced, they are still your legal spouse, then you can, and they're still covered on your plan, you can still file a claim on them. It's only when you're divorced that they are no longer your legal spouse. So for the person that asked that cancer question, this shows you here just some more information on what the cancer diagnosis would include. Any other questions? Well, if you guys are interested in joining the Allstate or the Allstate, um, the accident webinar next week or next month, I think it is next week, then you can go here to our webinars page, which I've posted in the chat. So someone said, do you have to provide documentation for the bypass surgery? So if you're filing a critical illness claim, yes, you have to provide documentation. And you would want to probably go into that critical illness plan certificate and read about what is required, or just reach directly out to Voya and ask them because they're the ones who would pay the benefit. But they do require documentation. The only thing Voya does not require documentation for is the wellness benefit. That's it. Sanders said you can claim wellness with both Allstate and Voya. Yes, they have separate screenings on their list, but both of them have wellness benefits on the critical illness, the accident, and the cancer plan. And I posted the links to the flyers in the chat to both of those. Thank you guys for joining today. And if you have any other questions, please reach out to us or reach out to one of the vendors. They also can help you. And I hope you guys have a great day. Thank you.